Hello, my name is Laurel Hall, and the topic that I am most passionate about is women and diabetes, especially African American women. I am passionate about this because I had a grandmother who had diabetes. I also have a granddaughter who has type 1 diabetes, and now I have developed diabetes myself. In the state of Arkansas, there's an estimated number of 75,000 adults with diabetes and didn't even know that they had diabetes. And then there's an additional 797,000 more who have prediabetes or had prediabetes. Is costly, and there are two types of diabetes. There's type 1 diabetes, which means that the body does not produce enough insulin. They used to call it IDDM, or juvenile onset diabetes, but they just call it type 1 diabetes now. And then there's type 2, which is the kind that I have. That used to be non-insulin dependent diabetes or adult onset, because it usually occurred after a person got older. And there's also one that is gestational diabetes, and that usually happens in women during pregnancy. And so the difference in type 2 and type 1 diabetes, the people with type 1 diabetes, they have to have insulin. People with type 2, their insulin can be maintained, or see, what do I want to say? It is, yeah, I guess you could say that they can take care of their insulin by you doing diet and exercise, and maybe taking some oral medication. It usually occurs after the age of 40. That's when my diabetes occurred, after the age of 40. And so the symptoms that people usually experience with type 2, they may have excessive hunger, excessive thirst, and they have those three P's: polyuria, polyphagia, polydipsia. And so because of diabetes, women especially have the risk of developing heart disease. And I know that to be true because not long ago I ended up in the hospital with chest pains. And so, how can we prevent diabetes, or how can we prevent the complications of diabetes, such as heart disease? Well, we can watch our weight, try to lose weight, which I'm forever on a diet. We can quit smoking if you smoke, or stay away from secondhand smoke. Control your cholesterol and your blood pressure. Of course, that's hard to do right now with school. If you drink alcohol, don't drink, or drink in moderation. And then try to get active and eat healthy. And if you're active and healthy, it should take care of the diabetes and the need to take medication. And again, I'm passionate about that because I have it, and it is ever increasing in African American, especially women over the age of 40. And so I think that as health professionals, or as a health professional, it's my responsibility to help take care of those people around me, and my patients, and my community. And so as a nurse, I do trainings monthly at my church, or at least I did before Corona. And so I plan on doing that again because diabetes is costly. There are a lot of deaths and complications related to diabetes.